I am so confused. I get so much parenting advice from so many people. I just don't know what to do. I need the doctor to help me.
Never fear, I'm the doctor.
No. Not that doctor. Dr. Jason, can you help?
Put some honey on a pacifier. It'll soothe the baby's throat.
You should never give honey to a baby under a year of age. Honey has some bacteria spores that can live in it that can make babies sick. They don't cause any problems for older kids, so it's okay to give them when they're a little older, but never give a baby honey.
You rub a little whiskey on their gums for teething relief. It's a trick that's been around for ages.
No. No alcohol to babies. No whiskey, no brandy, no alcohol to babies.
Why, yes, of course. A warm bottle helps them sleep through the night.
A warm bottle may actually help the baby to get to sleep. Keep in mind that most babies like their formula or breast milk to be served at body temperature, a nice warm 98.6 degrees, but it shouldn't be served any warmer than that.
Cloth diapers are so much gentler on the skin, and they're better for the environment, too.
The debate between cloth diapers and disposable diapers goes on. And I won't really take sides. This is really an individual decision for parents to make. Keep in mind that cloth diapers do have some extra steps that are needed to keep them clean and sanitary and to keep the baby's skin clean as well.
Let them cry it out. It toughens them up and helps with independence.
I don't routinely recommend letting babies to cry it out. It may be of some value to help babies who are 6 months of age or older learn to self-comfort. If you're going to do that, the best way to do it is to look at your watch or clock. Give them 5 minutes before you go to the baby. That 5 minutes is going to seem like an eternity of listening to the baby cry, which is why I suggest looking at a watch or clock to make sure that you give a set period of time. After 5 minutes, go into the baby and help them comfort. After a period of time of doing this, you can gradually lengthen that period of time out from 5 minutes to 6 or 7 minutes to 8 or 9 minutes. I don't recommend letting the baby cry for more than about 15 minutes at a time. If the baby gets to 15 minutes, please go in and comfort the baby.
Homemade baby food is much better. Just puree it.
Homemade baby foods have their advantages and their disadvantages. Keep in mind that if you are making a homemade baby food, that food is not subject to FDA regulations that keep it safe or monitored for safety for babies. You also need to make sure that if you're making homemade foods, you stay to about the same consistency of foods that babies are tolerating in baby foods.
Fresh air and sunshine are the best remedies for little ones' fussiness.
It's good for babies to get some fresh air and sunshine, but keep in mind that babies should not be out in direct sunlight. They should be shaded from the sun until they're old enough to apply sunscreens, which even for baby sunscreens is generally about 6 months of age.
Co-sleeping helps to build a strong bond and ensures a good night's sleep for everyone.
Co-sleeping with a baby is not recommended. Those things that make a sleep environment comfortable and happy for an adult can actually cause breathing problems for babies. And in fact, many cases of sudden infant death syndrome or other bad events that have happened to babies in sleep are the result of an adult rolling over on the baby, dropping the baby, or of some blanket or pillow or other object in bed with the baby and an adult that causes breathing problems. It is not recommended to co-sleep with your baby.
There's nothing like a little brandy to settle a colicky baby. Oh yeah, a little brandy.
No alcohol for babies. No brandy. It's not helpful for teething and may actually be harmful to the baby. No alcohol for babies.
Don't overdo it on those vaccines. Trust your instincts when it comes to shots.
I know that there are a lot of vaccines recommended during your baby's first years. But those vaccines are very important to keep your baby healthy. Your healthcare professional has spent a good portion of their life and career studying these vaccines. They know what to recommend and what is safe for your baby. Please trust your healthcare provider and accept all the vaccines that the healthcare provider recommends for your baby.